The world seems to have come to a standstill. The future appears dark. Fighting and winning the battle against COVID-19 is Zambia's main goal at hand. Currently, Zambia is experiencing a second wave of COVID-19. Tests suggest that the new variant in the country is similar to that reported in South Africa, parts of Europe, and the United States of America. Zambia has recorded the highest number of positive corona cases since March 2020, when the country was first hit. COVID-19 is upon us once again.
Today's program looks at COVID-19. What we do together will determine how this pandemic unfolds. Welcome to Health in Focus, my health, my responsibility. I am your presenter, Dr. Kalangwa Kalangwa.
Health in focus. You know better, you get better. Health in focus. Focus on your health in focus. Your health is your wealth. Your health is your focus on your health. Yeah. Health in focus. Universal health coverage in focus.
The coronavirus is a worldwide health pandemic. Globally, the cumulative number of people affected is fast approaching 90 million. About 60 million have since recovered. Sadly, around 1.9 million have died. In Zambia, the cumulative number of people affected is 23,000. Around 20,000 recovered, and there are above 400 mortalities so far. Lusaka remains the main hotspot. Hundreds of cases are being recorded every day. COVID-19 related deaths are on the rise. Realizing the increase in COVID-19 cases, the Ministry of Health has stepped up its awareness drive. No Zambian should die from coronavirus.
Now, when you look at what this COVID is, so COVID is an infection which is caused by a certain germ. Now, this germ belongs to a class of germs which are called viruses. And again, even when you look at these viruses, there are different types of viruses, and this type of germ is called a SARS-CoV-2. So the infection which it causes is what is called COVID. Then, of course, because it was found in 2019, it's written in full as COVID-19. What we have seen, of course, which is different from the earlier one, is that patients who have this new mutant virus or this new strain of the virus is able to be transmitted faster compared to the old ones. With the transmission being faster, it means it's able to now attack many people. So if it attacks many people with risk factors, like if it attacks someone with diabetes, then they are going to present with a severe form of the disease. It affects the elderly, they'll present with a severe form of the disease. But now we are seeing something different. We are seeing the young ones being presented with a severe disease once they're affected with COVID, which in the other virus we never used to see. So there's this aspect also of the severity. Now, the testing is something which has been expanded. You can see from where we're coming from. When you're having just tests in hundreds, we are now having tests above 10,000. And we can only have tests above 10,000 if you have multiple testing points. So now every province has testing points. Every district has testing points. Every hospital that you go to, there are testing points. Now, in the hospital, there are testing points for the patients who are admitted, and there are also testing points for the people who are coming from outside. Provinces are going to establish even testing points outside the hospitals so that people can go, those who have symptoms and they need to be tested, they don't have to go to the health facilities and be tested from there. Because the health facilities right now are highly infectious. That's why we're having a number of cases. There will be points which will be opened up in various districts outside the hospitals for testing. As of now, it's all health facilities, hospitals, they're able to test for those who are inpatients and is in for those who are outpatients and for people who are coming from outside. So the major things which government has put in place really are issues emphasizing on issues of masking up. Now, masking is very, very important. I know there are certain people who may have reservations towards the use of masks, but when you look at the advantages which masks will give over the disadvantages, would rather go for masking up. Infections are prevented by more than 94% just by masking up. We also have this issue of physical distancing. If someone can observe more than a meter from the other person, then you reduce the chance of someone getting COVID. We have issues of hand hygiene. If you can at least wash your hands regularly, then you at least minimize the risk of getting an infection from a place where the COVID may have been, the virus may have been. We're also talking of the issues of avoiding public places. When you look at our epidemic, most of the cases are coming from the public places.
Festival gatherings to celebrate Christmas and the birth of a new year saw the nation ignoring COVID-19 preventive guidelines. Face masks, social distancing, regular sanitization and washing of hands were all thrown away. A false sense of safety around the virus increased. The ministry's call to cautiously observe and adhere to the preventive guidelines was disregarded, and now the current surge is frightening.
I think that the general public at the moment think that we have no COVID in the country. The reality on the ground is that we have severe cases of COVID. And what is different now is that these cases actually is that the people who are coming in are the young ones. We have the 3-year-olds dying. We have 22-year-olds dying because of COVID.
Mask didn't know because this was so very close mask but in cover face man ni madwala mutu manwa I think pay mama mvutika no pay each time cover face mask ni madwala mutu mani baba mutu so no wanda ni makangi one same kaidi COVID ni sta effect na your face mask na yeni babisa mutu
oro sina oneko wana nadwala COVID oma bantu bane bali na bantu bane banadwala babululu bao nkani izo bamatiuza.
Okay, COVID ilipo kukiwa na manamba ya bantu badwala COVID momeni ashita right na banufa mwamba ilipo COVID.
The COVID-19 health burden on the Zambian health system is becoming heavier every day. Once closed centers are now open and overwhelmed.
So as of October to November last year, we had very few patients. At one time, actually, we had 0 patients in this hospital. But beginning mid-December, we started seeing patients, the numbers rising. And as I'm talking now, we are hitting from 0, we are hitting up to 60, and we expect that we'll go probably up to 100 patients within a short period of time. In ICU where we are standing now, this is the ICU Levi Manawasa COVID Center. We had no patients until 2 weeks ago. Currently, this is a 12-bed ICU. We'll have 8 patients at the moment. And like I'm talking now, is that 8 of these patients are very critically very ill. We don't sleep. There's always people working here. Sometimes we knock off as late as 06 hours when we've been waking up the whole 24 hours. And we have to report back after knocking off at 06 hours. We have to come back in the center again at 008. So it is a very big center. At the moment, we are receiving 8 to 15 patients per day. On the other side, our sister center, which is the UTH, which was not open, we had to open it 2 weeks ago. And the reason is because we're being overwhelmed here by the number of cases that we are seeing. As I'm talking now, UTH has opened up to 200 bed spaces. We have also about 200 bed spaces to just accommodate the number of patients that are coming in.
Managing COVID-19 patients is a tall order. The procedures involved are hectic and expose health workers to a huge risk.
And the patients that you are seeing are the people that were within the community. They didn't have COVID as well. They were moving about as well. So what we are trying to say is that COVID is real. It hurts, it pains me when I hear people saying, asking, is it even real? Are people sick? When we are seeing people dying out of COVID, when we're seeing people struggling to breathe, they just want to get back to their homes, to rejoin their families.
COVID-19 is real. Zambia has been hit by the second wave. This second wave is aggressive, it spreads faster and is severe compared to the first one. No Zambian should die from COVID-19 because it is preventable. The government, through the Ministry of Health and cooperating partners, is in it. You too should be in it.
Remember to observe the 5 golden rules. 1. Mask up when in public. 2. Maintain a physical distance of at least 1 meter between you and the next person. 3. Regularly wash your hands with soap and water or use an alcohol-based hand sanitizer. 4. Stay at home. Avoid crowded places. 5. If symptomatic, visit a healthcare facility as early as possible. Together, we can win the fight against COVID-19. Until we meet again in the next episode, I am your presenter, Dr. Kalangwa Kalangwa. Bye for now.